So my name is Faith Selchick. I'm the Regional Director of Cancer Services for the Western region at Westchester Medical Center Health Network. So I am an oncology nurse and an oncology nurse practitioner before I went into administration. I currently oversee cancer services, so nursing, infusion, physician practices, anything that involves cancer care is under my um, role here in scope. So I received the CARE Award and I was incredibly humbled and honored. I was so surprised. My organization did this surprise celebration where they disguised it under a nursing operations meeting. And when I walked in, the room was decorated and there were all my colleagues were there. Some weren't nurses, so that was strange. I was like, why are you here? And it was just such a heartfelt moment to just feel like the energy in the room. I was totally overwhelmed, which if you see any of the clips, you'll see that. So it was just such an amazing moment. Receiving the CARE Award is, as I said, both humbling and deeply meaningful to me. It represents more than just individual recognition. It reflects the collective spirit of compassion, advocacy, dedication, resilience, excellence, all of these things that involve becoming an oncology nurse and the spirit of oncology nursing. It reminds me of why I entered the field. So to walk alongside patients and their families during one of the worst times in their lives is really the essence of oncology nursing. And it takes a team, right? It's not just about me, it's about everyone I've ever worked with. It's about the mentors that I've had along the way, the staff that come together and collaborate to make sure that patients receive the highest level of care and also a compassionate and empathetic experience. Learning that I was the award recipient, it affirmed to me that you make a difference regardless of what you do in oncology, whether you're still at the bedside or you're a practitioner or you're in leadership. You make a difference in advancing the quality of care, the safety of care, and access to care. All of it comes together. And on a personal level, it's a tribute to every colleague and mentor and patient who has shaped my journey. And patients are the biggest part. They're at the center and they allow us to be part of their journey. They open their hearts to us during one of the most vulnerable times, and that takes courage. So I have patients that I am in touch with that I took care of 10, 15 years ago. They've become part of my life. And so they're humans that just have such a deep impact on you that you don't just leave them when their care ends. They stay in your heart. And so this award, it just reminds me of all those experiences that I have been through with people as they are putting forth all their strength and energy into fighting this disease and how they really embrace their relationship that we developed along the way. So it comes full circle, right? It's just an amazing reminder of what we do really, really matters. So I think this award also symbolizes the strength of teamwork, the power of listening, and the responsibility that we carry to improve cancer care every day. So the CARE Award, I said this before, but I keep saying this, I keep reiterating it. It is not just about me. It's also about honoring the profession of oncology nursing and reaffirming my commitment to leading with empathy and integrity and vision for what the future of cancer care should look like in today's day and age. So I think it's so important to recognize our colleagues, their strengths and their energy and their dedication, right? Oftentimes we take the time to report complaints or report things that are not working well. But in my role, I always take the opportunity and I go the extra step to also acknowledge what is working, what is great. And I think there's so many great things about oncology nursing that people don't understand or realize because if you're not in this field, you can't possibly imagine the emotional toll that this field really takes. And it takes special people to go into this field and dedicate the time and energy. Nursing in itself is such a thriving and fantastic field to be in. Every avenue of nursing is so difficult, and it requires special people who are filled with empathy and compassion and really emulate that. Oncology nursing is another layer of that because now we're faced with the chance that each patient may or may not make it, right? And we can provide the best care to them, and we can make sure they get the best evidence-based treatment guidelines and clinical trials and all these different avenues that we have at our fingertips. But what is so important to go alongside that is pair it with the oncology nursing and the compassionate care. So I think it's just really inspiring to have been nominated for this because my inside, like my entire life, is pretty much dedicated to this field. And to me, it was just such an honor to be recognized. How I felt, my heart was just bursting. I think that it's just another rejuvenating layer, right? It's just a reminder, and it kind of says, thank you for what you've done, but it's a call, right, to move forward and to continue leading and inspiring people because you really don't know your impact. So I would just encourage anyone who has this understanding and awareness to just consider looking into nominating nurses, looking into what nurses really put forth in all the different levels of nursing that we have. And we dedicate our whole being to our careers because ultimately the patient's at the center, right? And we come every single day to work to fulfill a common goal. And that is make the patient feel as good as possible for as long as possible. It reaffirms what I'm doing with my life and all my dedication and my devotion to this field. It reaffirms the difference that I know I make every day. And sometimes when you're in it and you're going through your daily grind and you have your struggles and the difficulties that impact your day, it's a reminder to not forget what we're doing. Right? It's a reminder that we are serving a higher purpose collectively, and it takes people in all the roles that we serve in healthcare to really make it work. So breaking down silos between disciplines and providing a more integrated care is the goal. And that is what I love about where I work is that is the goal here. To make sure that we are able to provide an integrative cancer experience, and we have senior leaders who are dedicated to that mission. And so I find that inspiring, and that just rejuvenates my passion for this field by working under leadership that really understands the importance of that in cancer care. So with the $1,000, I just want to share what I'm going to do with that. So I am going to be donating that back to the hospital. We have a brass bell for treatment completion in the radiation oncology suite, but we don't have one in the infusion center. And it's important to patients to be able to ring that bell, right? That's their victory bell. And so what I am going to be doing is I am meeting with our hospital foundation, and I will be donating a bell for the infusion center with the prize money. And I think that there will be a lot of patients who will be really excited and appreciate that as they complete their treatment journeys.